This is the second part of the video, inflammation. Here we'll be covering about the chemical mediators of inflammation and chronic inflammation. The mediators of inflammation. Okay, the chemical mediators. They are released in two formats, self-derived and plasma protein derived mediators. Okay, so self-derived mediators are vasoactive amines like histamine, serotonin, okay, arachidonic acid metabolites, lysosomal components, platelet activity factors, cytokines, and free radicals. Whereas plasma protein derived mediators are the one which has kinase system, clotting system, fibrinolytic system, and complement system. Now let's begin learning about these systems and the cell derived mediators in detail. Now let's begin with self-derived mediators. First is vasoactive amines. In them, histamine is most important. Okay, stored in granules of mast cells, basophils, and platelets, they are released as a response to stimuli like cold. Remember allergic reactions? So their histamines had released first, correct, causing these allergic reactions. Other than that, trauma, irritant chemicals can also release this histamine. Okay, they increase vascular permeability, causes edema in tissue. Other than that, they also cause vasodilation, itching, and they are the most potent ones when compared to serotonin. Alright, and they are usually released in various of stimuli like physical injury also. Alright, now histamine causes arterial dilation, as I told you, vascular permeability increases. Okay, and found in platelets, it releases during platelet aggregation as well. Now let's talk about serotonin, also known as 5-hydroxytryptamine. Okay, this is present in chromaffin cells of spleen, nervous tissue, mast cells, and platelets, and even present in the gastrointestinal tract. Okay, it causes vascular permeability and vasodilation similar to histamine, but it is not as potent as histamine. Now moving towards neuropeptides, they play important role in initiation and progression of an inflammatory response. They are secreted by sensory nerves, okay, and have various leukocytes. Like for example, substance P, neurokinin A, okay, they transmit pain signals, regulate blood pressure, stimulates and secretes endocrine cells, and increases vascular permeability. Now talking about lysosomal enzymes, they have two types. They either are secreted by specific granules or by larger azurophilic granules. Okay, so the one which are secreted by specific granules are alkaline phosphate, type 4 collagenase, lysozymes, etc. Larger azurophilic granules secrete MPO, okay, then your elastrase, collagenase, etc. Now let's move ahead. Now let's talk about arachidonic acid metabolites. Okay, now these are released from cell membrane by phospholipase and they're activated via two pathways. It could be cyclooxygenase pathway or lipoxygenase pathway. Talking about lipoxygenase pathway, lipoxygenase is a fatty acid enzyme present in COX-1 and COX-2. Okay, they activate arachidonic acid to form prostaglandin endoperoxide, which enzymatically transformed into prostaglandin H2. Okay, further it results in formation of prostacyclin thromboxane, which causes vasodilation, inhibits platelet aggregation. Okay, thromboxane A2 causes vasoconstriction, promotes platelet aggregation. Okay, even it further forms PGD2, that is prostaglandin D2 and prostaglandin E2, which causes vasodilation and increases vascular permeability. Okay, now let's move ahead and talk about release of arachidonic acid by lipoxygenase pathway. Now lipoxygenase enzyme in neutrophil acts on activated arachidonic acid to form hydroperoxide, okay, hydroperoxide, acid, which further causes peroxidation resulting in hydroxyl compounds, alright, which results in chemotaxis, leukotriene formation, causing vasoconstriction, bronchospasm, increased vascular permeability. Now let's talk about platelet activating factor. Released by platelets, mast cells, basophils, macrophages, endothelial cells. They are present in both secreted as well as cell-bound forms. Now their main function is platelet aggregation, vasoconstriction, increased leukocyte adhesion, chemotaxis, degranulation, and in low doses it also causes vasodilation. Talking about cytokines, proteins produced by many cell types such as activated lymphocyte, macrophages, endothelial cells, epithelial cells and connective tissue cells are chemokines. Okay, they are from family of chemoattractants like interleukin 8, interleukin 1, interleukin 6, etc., which play important role in inflammation. About plasma proteins derived mediators. They are derived from plasma proteins synthesized in liver, and that is why they are known as plasma protein derived mediators. Alright, now they have kinase system, clotting system, complement cascade. Alright, now let's begin with kinase system. In kinase system, it is activated by factor 12A, which generates bradykinin. Okay, this is bradykinin is first generated in early stages of inflammation. It causes vasodilation, then smooth muscle contraction, increases vascular permeability, and also induces pain. Alright, talking about the clotting system, again factor 12A initiates clotting system which results in formation of fibrinogen, okay, which acts upon thrombin to form fibrin and fibrinopeptides. Now this also again increases vascular permeability, causes chemotaxis for leukocyte and has anticoagulant activity. Talking about fibrinolytic system, now these are activated by plasminogen activate. Okay, plasminogen activator acts upon plasminogen present as a component of plasma proteins, okay, to form plasmin, which further breaks down fibrin by plasmin forms, and formation of fibrinopeptides or fibrin split products are done or it occurs. Okay, talking about the complement system, there's classic pathway through antigen antibody complex and alternate pathway via immunologic agents like bacterial toxins and etc. Okay, they activate basophils and mast cells, release histamine, causes again increasing vascular permeability resulting in edema, also causes phagocytosis. Okay, then these components like C3b causes opsonin, okay, formation of opsonin, the serum which is coated on the bacteria which needs to be killed. All right, coming to inflammatory cells, polymorphs, monocytes are macrophages, lymphocyte, plasma cells, eosinophils and mast cells play important role in inflammation. Coming to the morphologic patterns of acute inflammation, serous inflammation is where there is fluid present in form of serum or watery content is present. Okay, like the presence of fluid in peritoneal cavities. Then comes cathedral inflammation. Now best example is common cold. Here what happens is there is surface inflammation of epithelium which produces increased secretion of mucus, because of which there is a cathedral inflammation occurring. Now fibrinous inflammation is usually seen in acute pericarditis. Okay, there is fibrin content of fluid exudate is high. Then comes hemorrhagic inflammation where there is vascular damage, there is lot of blood which is present, like in cases of meningococcal septicemia. Okay, then talking about suppurative inflammation, that is nothing but your abscess formations. So there is formation of abscess in such cases, like for example emphysema. Membranous inflammation is seen in pharyngitis. All right, Pseudomembranous inflammation, it's an inflammatory response of mucous surface to toxins, okay, or irritants like pseudomembranous colitis. All right, and then there is necrotizing inflammation where the tissue cells become necrosed, for example in cases of gangrene. Then ulcerations, okay, in such cases ulcers are formed. There is damage to the up surface of the organ, okay, which is produced by inflammation. Talk about the outcomes of acute inflammation. Resolution, there is complete return of the tissue, normal tissue, okay. When the tissue changes were very slight, it comes back to normal. The cellular changes were reversible, okay. Then comes healing, where the tissue loss in acute inflammation is superficial. Healing occurs by regeneration, okay. If the tissue destruction is extensive, healing occurs by fibrosis. And then there is suppuration, where pathogenic bacteria causes acute inflammation, okay, which results in severe tissue necrosis. Let's begin talking about chronic inflammation, defined as a prolonged process in which tissue destruction and inflammation occurs at the same time. Now it occurs in three ways. These three ways are chronic inflammation following acute inflammation, recurrent attacks of acute inflammation, and chronic inflammation starting de novo. Okay, now let's talk about chronic inflammation following acute inflammation. Here the tissue destruction is extensive. The bacteria survive and persist in small numbers, okay, resulting in acute inflammation. Okay, for example, osteomyelitis. Talking about the recurrent attacks of acute inflammation, the name itself says that the repeated bouts of acute inflammation accumulate in chronicity of process. For example, recurrent UTI or urinary tract infection can result in chronic pyelonephritis. Alright, now let's talk about the chronic inflammation starting de novo. Now let's understand what is chronic inflammation starting de novo. So when infection with organism of low pathogenicity is chronic from the beginning, that is nothing but chronic inflammation starting de novo. For example, tuberculosis. Let's begin by talking about the features of chronic inflammation. The first is mononuclear cell infiltration. So here majority of cells which are activated are mononuclear like phagocytes and lymphoid cells. Now talking about the necrosis or tissue destruction. So it is about by activated macrophages which release variety of biologically active substances like protease and lipase. Okay, and this is a central features of chronic inflammatory lesion. Talking about the proliferative changes. Now, because there is necrosis, there is proliferation of small blood vessels and fibroblasts are also present or activated. Okay, now this results in formation of inflammatory granulation tissue. Understood? Now, coming to the types of chronic inflammation, there are two types. Chronic non-specific inflammation and chronic granulomatous inflammation. Talking about the chronic non-specific inflammation here, the irritant substance produces non-specific chronic inflammatory reaction resulting in formation of granulation tissue and healing occurs by fibrosis. For example, chronic ulcers, lung abscess, chronic osteomyelitis. Okay, now coming to chronic granulomatous inflammation, granulomas are basically defined as circumscribed tiny lesions about 1 millimeter in diameter composed of collection of modified macrophages called as epithelioid cells and are rimmed at periphery by lymphoid cells. Now let's begin talking about the pathogenesis or formation of this granuloma in detail. Coming to the pathogenesis of granuloma here, basically what happens is these macrophages, as I told you earlier, they end up engulfing the bacterias, correct? Which these are supposed to destroy or degrade, but they fail to do so. And because of that, they undergo morphologic changes forming epithelioid cells. Now, this failed macrophages present this antigen which they had engulfed and failed to destroy to CD4 T cells. Now, this activated CD4 T cells and macrophages together form cytokinin, which perform following rules like TNF alpha is a cytokine which is formed which promotes fibroblast proliferation, activates endothelium to secrete prostaglandins, which are anti inflammatory in nature. Then comes interleukin 1 and interleukin 2, which stimulates proliferation of more T cells. Okay, and then interferon gamma, which activates macrophages. So, this is how granuloma is formed. Now, the coming to the types of granulomatous inflammation, they are like tuberculosis, leprosy, and sarcoidosis. So, basically, inflammation is a body's defense system which is useful or essential in elimination of pathogens. Okay, and it helps in healing. Like, share, and subscribe, and please leave a comment. Thank you.